We don't have all the answers yet when it comes to tinnitus. The way I look at it is that if you're well, you're in a normal environment and you have normal hearing, your brain is able to filter out the background static generated by the inner ear and the nerve of hearing. But, for example, if somebody's hearing were to change, some of that background static goes through to the brain, goes through 5 way stations or thereabouts before it gets to their conscious level. So for the vast majority of people who develop tinnitus, it's more noticeable late at night when it's very quiet. The sound that they can hear is the one that they're generating. It's also more noticeable when people become stressed or anxious. Most patients will describe a hissing sound or a high-pitched squeal, but it can vary quite a lot from person to person. When it comes to assessing a patient with tinnitus, it's important to take a detailed history and to examine that person. All my patients will undergo an audiogram and tympanometry. It's important that I understand how well they can hear and to look for any obvious pathologies that can be addressed. By and large, patients with tinnitus, once they understand why they have that problem, do very well, and the tinnitus will come and it will go. There are some situations, however, where the tinnitus could have arisen because of something more sinister, and so some of my patients will need to undergo an MRI scan just to exclude those other things that might worry me. For example, a benign swelling that's pressing on the hearing nerve that can make the hearing go down and make tinnitus much more likely. In terms of treatment, some patients benefit from a hearing aid because if we can gather in more environmental sound, it can suppress the tinnitus. It's important to educate the patient so they understand why they develop this particular symptom. But some patients also benefit from tinnitus retraining therapy, which is a form of cognitive behavioural therapy, but with some modifications in terms of sound and environment. And those patients do very well indeed.